coronavirus is a very good case for Medicare for All, but as doctors, we see the case for Medicare for all the time. Our diabetic patients can't afford the insulin. They need to stay alive. People with chronic conditions come in late when they've already gotten complications because they can't afford to see their doctors. Some of those people are uninsured, but many of them have insurance, but they can't afford to use it due to co-payments and deductibles. We see immigrants who are afraid to seek care because of the new draconian immigration laws that put their immigration status at risk if they use public services like health care. So there's plenty of case already for Medicare for All. I think that's the reason why the majority of exit polls show that voters overwhelmingly support the idea of Medicare for All, at least from the Democratic side. We won't have a vaccine for a while. We may find that some antiviral drugs are a little bit helpful. These can be very expensive, and it's really critical that they be paid for everyone. We've been talking a lot about vulnerable populations like poor people, like immigrants, but the lack of Medicare for All is forcing us to fight this epidemic with a hand tied behind our back, and that threatens everyone, including wealthy people and people with insurance. 25% of cab drivers don't have health insurance in this country, 12% of home health aides, 15% of cleaners. So rich people cannot avoid coming into contact with this epidemic just because they're rich. No matter how much money you have, you cannot buy your way out of this epidemic. We're going to have to conquer coronavirus together, and that's the whole idea behind Medicare for All. My other point is that these one-off measures are great, Cuomo's rules or the $8 billion that's been released, but one-off measures leave us fighting this epidemic with too little, too late. We needed these things in place a month ago or 2 months ago, and we need these things in place for the next epidemic and the next one after that. We need a health system that lets everybody who has symptoms go get the health care they need and get the information they need to stop spreading the virus.